you want to improve as a dentist in any field of dentistry, for example, and you want to enroll inside of aesthetic dentistry, what you need is a really good fundamental. On top of this fundamental, you can later build and improve in several fields. This fundamental is given to you in a good program. For example, the European Specialist Program in Aesthetic Dentistry. Well, we will teach the dentists first to be good professionals in aesthetic dentistry and to have a positive attitude towards patients and towards aesthetic dentistry. Then we will start with the first module where we will see everything that they can learn about veneers. Direct veneers, indirect veneers, no prep veneers, prep veneers, whatever. Then in the second module they will learn how to make really professional photography, which is very important for patient communication, for example, and for documentation. And on top of this, in this module they will learn how to make a thorough smile design. In the third module then we will focus on composites. Posterior composites, anterior composite, adhesives, lamps, how everything works together, and they will learn from the basic on to distinguish what is a good adhesive, what is a good composite, and how to use these. In the fourth module, they will learn how to make a nice frame for their artwork they did on the teeth, okay? That means they will get a facial aesthetics course. That means Botox and fillers and how to use them to make a beautiful appearance. In the fifth module, they will get to know everything about ceramics and CAD/CAM and the new technologies. And in the sixth module, they will learn everything about non-invasive aesthetic dentistry. That means microabrasion and bleaching, and on top of that, how to use lasers also for crown lengthening and respecting always the biological width, which is very important. What makes this program very special is that the students will get a big load, a high percentage of the time of hands-on workshops. Okay, so they really will do a lot of work that they then later can put on patients. But on the other hand, the professors of this program are very well selected. And on top, the organization is so thoroughly looking every detail that a lot of things that